Nora Speaks is a weekly podcast that tugs at the soul and consciousness of the Black community. With show topics such as youth empowerment, education, women's impact, and civic engagement, Nora Speaks challenges the listener to not only join the movement, but be the movement. On the show, you'll learn from insightful guests who have demonstrated capacity in these fields and more, and I'm your host, Nora Muhammad. Welcome to the show. Welcome to another episode of the Nora Speaks podcast, and I am your host, Nora Muhammad. And as always, it is a privilege and a pleasure and a blessing to be with you in another week. And, we know that there are some people who did not wake up this morning, and we are grateful to be among those who did. And because we did, then I would encourage you to make the most of every single moment with your family, with your friends, with those who you care about. Make the most of every single moment. Because as I said, there are some who did not have the fortunate blessing to wake up this morning. And, I'm grateful to be here. I'm grateful to be sitting down at the microphone, preparing another message for the listening audience. And, we are still in the midst of this world emergency, and our lives are very changed. Our mobility is changed in terms of being able to just go freely to the park or go to work. For some of us are essential employees. And then because we may be essential employees, then there's still so many considerations that we must take even to go to our jobs. So I would encourage you to be safe, to be thoughtful about when you're going out, where you're going, and, certainly following the guidelines that are given by your state or local governments. Just be safe. Just be safe. And, unfortunately, there are many people who have lost their lives, but there are so many people that have recovered, after contracting COVID-19, after having the coronavirus. And, we sometimes are focused on the numbers that, give us the most excitement or shock. And so when we're watching the numbers of those who have passed away, it's also important to take a look at the numbers of people that have recovered, because there are people who are recovering. And, and I say that because we have to really do a good job of protecting our mindset, protecting our mentality. This can be a very fragile time for so many people who may have the challenges of mental health or addiction, and, being confined, and, having our mobility limited. That can really impact people in very significant ways. So I encourage those who are listening to take all appropriate measures to protect yourself, and to, put our minds on joyful things, to set our minds on things that please us, that make us happy. Think about in our lives those things that we're grateful for, even if you're just starting with waking up in the morning. And it's so important, because so much of American society, society I live in, so I can't talk about, any other society. American society is a society that's most relevant to me. So much in American society is, it doesn't promote mental health. It doesn't promote wellness. I remember being younger, and so many television shows and movies had people drinking alcohol and smoking cigarettes, and the portrayal of those activities were made to look kind of cool and attractive. And as things have changed in society, then there are people who don't smoke cigarettes on television shows or in certain movies. But even when you're watching a television show, after someone comes home from a long day, the first thing they do is pick up a drink. They're at the office, and they pull the whiskey from their bottom drawer, and they have two glasses there ready, or 2 shot glasses. And so much of what's in our popular culture um, does not promote health. It does not promote wellness. And, popular culture certainly affects or impacts what we think, and it impacts our lifestyle choices. And so much of what we are seeing specifically in the Black community, so much of what we're seeing in terms of people who are dying from this disease, or those who they say are most at risk, are those who have cardiovascular disease, diabetes, cancers, renal issues, kidney issues. So those medical issues specifically are related to lifestyle. And I'm not talking about some congenitive issue that, you or a family member may have had, but to a great extent, what we experience in terms of our medical issues are related to lifestyle. And so I want to I've talked about lifestyle in a couple previous episodes, but I want to talk about the benefits of fasting in this episode, fasting to preserve our health. And I remember when I was about 18 years old, and I was introduced to fasting and just different lifestyle choices, dietary choices. Obviously, being a Muslim, fasting is something that Muslims do. And specifically being a member of the Nation of Islam and receiving the teachings of the Honorable Elijah Muhammad, there is a unique dietary regimen, I guess you can say, that we have. And I remember when, early on when I would share, because I found Islam at 18 years old, and, I was excited and I wanted to talk about it to everybody. And as I would share some things about the diet or the dietary guidelines or dietary recommendations, then so many people would encourage me not to follow them because, fasting, oh, that's not good for you. You have to have, 3 to 6 meals a day. Eating 1 meal a day, that's not good for you, your blood sugar. And so early on, I got a lot of pushback in terms of implementing some of these dietary principles in my life. However, what I have found is that, I'm over 18 years later now, well over 18 years later, that following many of those or all of those dietary recommendations just produce good health, and it produces wellness, and it can contribute to even our mental wellness. So when we talk about fasting, let's talk about what that is. And I'll also add that now, years ago when I was learning, about the benefits of eating 1 meal a day, which is eating, once every 24 hours. Well, fast forward now, the world is talking about the benefits of intermittent fasting, which is essentially, skipping a meal or two and then eating 1 meal. And some people may just do this once a week, where they won't eat breakfast or lunch and they'll eat dinner. Some people are doing this several times a week. But this is something that we've been encouraged to do as Muslims every day, to eat 1 meal every day. And so when I'm watching now popular television shows and folks who are prominent in popular culture talk about the benefits of intermittent fasting, I just remember all of the negativity that I got all of those years ago when we were talking about and excited about 1 meal a day. And so what people are saying about this intermittent fasting is that not only is it helping them lose weight, most people, they're doing this because they want to lose weight, but they're talking about the other benefits of getting sick a lot less. They're talking about just their minds being so much clearer. And in general, when you set out a goal and achieve it, which is you have dinner, then you don't eat breakfast, you don't eat lunch. And remember, in this culture, in American culture, we are pushed to have breakfast. We're pushed to have lunch. We're pushed to have snacks in between these meals. So when you set a goal to refrain from something as natural as eating, as enjoyable as eating, then you come out on the other side after achieving that goal just feeling so good about yourself. So people now who are practicing intermittent fasting, they're just talking about the wonderful benefits that they're experiencing. And it does have benefits. And this is, something that, your Muslim friends, who are in the Nation of Islam have been telling you for years or sharing for years or experiencing themselves for years. So as we recognize that in our community specifically, we have some healthcare or medical vulnerabilities that can make us more susceptible to some of the worst outcomes of this virus, I want to share with you the benefits of fasting. And I'll start by saying, again, that, American culture just really, it does not encourage any kind of discipline around what we eat. And we know that, you are what you eat, and what we eat can sustain life, but what we eat can also hasten on our death. So it's important, and in a culture and in a time that does not encourage any really structural or restrictions on diet or restrictions in lifestyle, period. In a lot of ways, America is like a free for all. Whatever you want to do, whatever you want to be, whatever you want to say, just go get it. But on the other side of that are consequences, and we want to avoid those unwanted consequences of being unstructured in our diet. So, with fasting, fasting is, exceeding 24 hours without a meal. And, if you are going to have blood work, if your doctor wants you to have blood work, then your doctor will ask you to fast. And usually that's 8 to 10 hours so that they can get like a clean sample, And what does that tell us? That tells us that when we fast, it gives our blood an opportunity to cleanse itself. And so we know that, or maybe you don't know, but when we eat, our digestive system, our intestines, it's full of folds. And in those folds, food can get trapped in there. And some people who have dietary problems like diverticulitis, where they may eat a seed and a seed is trapped in the fold, then that can cause a sore, for lack of a better word. That can cause a sore in there. And so that can make our digestive tract very, very sensitive. And so diverticulitis is a very uncomfortable condition to live with. And so when we fast and we give our bodies a chance to, one, rest, we give our digestive system a chance to rest, but it also gives our body an opportunity to rid itself of whatever could be lingering inside of the folds of our intestines. And that's why, we can go so long, our bodies can go so long without food, without eating food, because there is still food. Even after you skip a meal, there's still food that's trapped inside of our bodies that hasn't been eliminated. So by eliminating a meal, it gives your body an opportunity to work on continual elimination of those things that are still caught. It purifies our blood, which I've already said. And, much of what we eat has some kind of contamination, some kind of toxin to it. People have concerns with GMO and what may be in the foods, and our foods may not always be pure. So when we moderate what we eat, then that impurity in the last meal isn't given strength by adding another impurity from another meal right behind it. So we are giving our bodies an opportunity to allow these toxins and to allow these impurities to be passed along and to be excreted from our bodies. So, when people talk about, eating 3, 4, 5, 6 times a day, I'm not someone who is a bully about meals, or I don't condemn anyway for the way that they eat. But to think about running the engine, or our bodies, or our digestive tract all day long. We have to think about, when are we giving our bodies a chance to rest? I mean, if I went to my doctor, she would probably tell me, make sure you're eating a good breakfast. And what we know in America is that doctors are not outliving their patients and are also succumbing to the same diseases or conditions that are acquired through lifestyle that their patients are. So we don't see a longevity in our doctors versus their patients. So if our doctors are also subscribing to a way of eating and a way of living that does not increase health, it doesn't promote health, then we have to be very cautious of what advice we take from our doctors. And not to say, and look, when you go to your doctor and your doctor's giving you advice with anything, you have to consider what the doctor is telling you and consider if it is right for you. So many of us just follow, everything that our doctor says. And if we haven't been there when the doctors have been trained, I mean, it's easy for a doctor to prescribe a pill because the patient won't get out and exercise or won't change their lifestyle. So if we don't have doctors that are not promoting healthy lifestyle, and they're having relationships with drug companies and medical equipment suppliers and things like that, we really, because everything's a business, we really have to be very cautious and thoughtful. And I've known people who never ask their doctor a question when they go to a doctor's appointment. They, whatever the doctor says, they nod their head, they take their prescription, they go and fill it. They don't inquire with the pharmacist about adverse effects, potential reactions, benefits. So we have to stop and pay attention to what our physicians are telling us and what the pharmacist is giving us, and we have to read the packaging. But so much of our health can be improved by choosing when we eat and choosing how much we eat, how often we eat. So when we're talking about fasting, literally stopping consumption of food for a designated period of time to give our bodies a chance to rest. There are people who are dealing with blood sugar issues. There are people who are dealing with issues related to lack of fiber or not having enough fiber in their diets. There are people who are dealing with hypertension or other cardiovascular issues. And, I'll tell you this, I'm not a doctor, so you don't have to follow my advice, but I have been practicing this. So I'm not telling you something that I haven't done myself and obtained the rewards from. But if we are following the food pyramid or the food charts that we're given, you think, when am I supposed to eat all of this food? I remember being in elementary school and we had the food pyramid, and I thought, man, this is a lot of food that a person is supposed to consume in one day. It seems like to consume all of it, you would have to be eating all day. But because our bodies are machines, it is not wise to run a machine all day. And so even when we're sleeping, our bodies are still digesting food because we've given it so much to work through in a single 24-hour period. So when you take a fast, I would encourage you, those people who do eat 3 or 4 or 5 meals a day, I wouldn't encourage you to go in a complete 48 hours without eating. Well, let me tell you how I fast. So today is, let's say it's a Monday. I will eat on a Monday, and then I will not eat Tuesday, and I will eat again on Wednesday. Or if you want to start your fast on Wednesday, then you can not eat Tuesday, or you can eat Tuesday, not eat Wednesday, and then eat again Thursday. And so that really spaces out that meal about 48 hours. But if you are somebody who eats multiple times a day, then I would encourage you to just eliminate a meal. And then once you've gotten accustomed to eliminating a meal, then I would encourage you to eliminate another meal. So now you're eating 2 less meals a day. And once you're down to eating 1 meal a day, then I would encourage you, once you're comfortable with that, take a day and skip a meal. And, I know how oh my gosh, I'm going to starve, right? No, it takes a lot longer than 48 hours or 24 hours to starve. So let's put that away. I'm going to be hungry. Well, yep, you sure will. You will be hungry. And so what's so wrong with being hungry? What is so wrong with wanting something to eat and not eating? Again, I go back to, we have such poor structure and discipline and principles to our diet that anytime, we feel the pang of hunger, we just go eat. And, we even eat just because we don't have anything else to do. I'm bored. I need something to do. Let me go to the refrigerator. This is American culture. So what is so wrong or so damaging about being hungry? Well, then you go find something else to do. Drink a glass of water, have a cup of tea, have a cup of coffee. During a fast, you can still drink tea, have coffee. I would discourage juices because they have so much sugar in them, and you'll be intaking sugar but no fiber to regulate how that sugar is absorbed into your bloodstream. And so I would discourage you from drinking juices, but certainly coffee, or tea or water. Try it. And, being hungry is not the worst thing in the world. And what is that you can eat, you're just choosing not to. And so even putting a new mindset around refraining from eating, we think, oh, well, I can't do this and I can't do that. That's how people think about this kind of lifestyle. I can't. Well, I can do whatever it is I want to do. But because I know better, I choose to do better. And so, yes, I can eat 3 times a day, 4 or 5 times a day. I can, but I don't want to because it's not good for health. So then I will eat 1 meal a day. And then occasionally I will skip a day. And then occasionally I may do a 3-day fast. But I can eat anytime I choose. But I'm making a decision to fast so that I can purify my body. I can give toxins an opportunity to be eliminated. I can clear my mind, because if you fast, anyone who's done it, you know how well that can clear your mind, which is going to produce better thinking. So I would really encourage those who are listening, especially in a time like this where, so many of us are susceptible to these viruses because of other medical issues that are related to lifestyle, then this is a good time to try something new. So try a fast. And again, if you are not used to eating 1 meal a day, if you eat 3 meals a day or 4 meals a day, knock a meal out, take one off and try that for a week, and then take another one off and try that for a week. And your body will thank you. But let me also add, some people who try to eat less, they have a negative attitude the whole time. I've got a headache. I'm hungry. I'm bored. What time am I going to eat? Put a positive attitude with anything that you do, because you're not going to get good benefits out of it if you have a negative attitude. Because remember, what we think impacts what we do. So make sure that if you are fasting and you want to get the good results from it, to have good thoughts about it. And so, I would encourage you to research the book, How to Eat to Live. Or if you just want to try the intermittent fasting, I would encourage you to try it. Just eat less. Fasting is a wonderful tool, and it's free to preserve our health, and your body will thank you. And so, whether or not you fast and take this advice, I would definitely encourage you to put some structure around our eating. Eat more raw fruits. Eat more vegetables during this time. Eat navy beans during this time. Navy beans are so healthy and so nutritious and so good for you. Make sure you're eating apples and oranges. You get the vitamin C from that. Make sure that you're, getting sources of vitamin D, and make sure that you're exercising and you're moving your body. At a time like this where we are in very unusual circumstances with, the limits to how much we can get about and move, it's very important that we still go outside and take a walk, in a safe place, or even in your house if you need to exercise. I don't know if it was the president of Ghana, but the president of some African nation, a 75-year-old leader who showed how he does exercises in his office because he can't always get out. And now he's encouraging his citizens to exercise in their homes, and he's doing it himself and made a video. So take some time and exercise 20 to 30 minutes a day in your home. If that's you going up, I have 3 stories plus a basement. So if I go from the basement to the top floor, then I've went on at least 3 flights of steps. So in your home, whatever you can do it, whether you're doing push-ups or sit-ups or you're doing jumping jacks. I mean, you don't have to have a fitness center in your home to exercise. And, there's so much on social media that you can research, or online that you can research, exercise to do in our homes. But make sure we're keeping our bodies moving. Make sure we're drinking plenty of water. Make sure we're opening up our blinds and our curtains and we're letting the daylight inside. And make sure we have structure around our eating, because there's so many funny memes, that I see where people are talking about, once the quarantine is over, how are they supposed to get out their doors because they have gained so much weight? So, and some people are calling it the COVID-15, like, okay, once this is over, I'll have gained 15 pounds because I'm eating and I'm not active. So what better time now than to try something new in your homes, which is taking a fast. Try it, fast for 24 hours, fast for 48 hours. Let your body have a chance to rest and to purify itself. And you will be increasing your own health outcomes. So much of our suffering comes because of the lifestyles that we have, that we pass on to our children, whether we're talking about food, whether we're talking about substance abuse, whether we're talking about alcohol abuse, the lifestyle, whether we live a sedentary or active lifestyle. So much of this is just what we pass on generationally, just certain traditions that we have in our own families or our communities. And as we see the Black community suffering the way it does, I encourage you to be a movement, to be your own movement, to take charge of your health, to be responsible. And I know that there's talk about, urban centers being food deserts, and certainly that is true. There are areas that just don't have fresh fruit, fresh vegetables. And so in this time, while we are quarantined or sheltering in place, I think it would be a good idea for local leaders to talk about ways to bring in fresh produce to the residents. And, there's so much that we can do together that we don't have to rely on government or corporations to do for us. So think about how we can get fresh fruits and fresh vegetables from the farms into our communities, onto our dinner tables. And in addition to that, I want you to consider the power of beans. Beans pack such a nutritious punch, and so people say, a Whole Foods or Trader Joe's or these places, the food is so expensive. Well, we don't have to eat expensive food to eat nutritious food, and that's something that I think is a myth that I kind of been wanting to talk about for a while. I don't know any food that is cheaper than beans, but as nutritious as beans. And I would encourage you, to learn how to cook navy beans. And there's so much you can do with them. You can make bean burgers, you can make bean pies, and you can make bean soup. You can make beans as a side dish in your meal. But make sure that, we don't get caught in the hype that because we in urban areas, and not everybody who listens to this is in an urban area, but let's not get caught up in the hype that because there are, quote, food deserts, then there are no nutritious food options. Some people or some governments say that there's food deserts, but there's supermarkets in these towns. They're just not the chain supermarkets that are ran by corporations. So just because your supermarket doesn't, or in your community, isn't part of a big chain. I mean, there's so many supermarkets in the city of Camden, and I remember them saying that Camden didn't have any supermarkets, and I could name 5. Now, certainly they weren't the big name supermarkets, but, the brother or sister that owned it was still running a supermarket. So let's not get too caught up and distracted in some of these mixed messages that we're getting. And we really, really can simplify things and simplify our health outcomes. So we don't need a lot of different foods to eat. If you like a lot of different foods to eat, you can try that with different fruits, different vegetables, different ways to prepare different foods. But I definitely would encourage you to moderate what we're eating, teach our children to do the same, stay active, drink plenty of water, and brothers and sisters, think good thoughts. So much can be changed with how we think about our circumstances. Because whatever we think about ourselves is true. If we think that we can't, then we can't. If we think that we can, then we can. Either way, you're going to be right. So think good thoughts and stay positive. And I would be interested in your experiences with fasting. How long? What's the longest that you fasted? I think the longest that I've fasted has been about 4 days. And actually, what I don't hear talked about very often is, and a friend of mine, we were talking about this recently, that about after the second day, maybe the second day, you don't even feel hungry anymore. The hunger kind of goes away. And so that's why I said, well, what's wrong with being hungry? You're not going to continually feel hungry. You can have a moment of hunger and you have some hunger pains in your stomach, but they go away. If you're taking a 3-day fast, you're not hungry the entire time. And, let's challenge our hunger. Let's be the Lord of our stomachs instead of letting our stomachs lord over us. And with that, then we can definitely improve our health outcomes and improve our odds of surviving any virus or any illness that comes to us when we are in good health. I want to thank you so much for listening to this episode of The Nora Speaks. I look forward to hearing from you. You can email me at info@noraspeaks.com. That's info@noraspeaks.com. Until next time, stay in peace. Thank you for listening to another episode of the Nora Speaks podcast. Be on the lookout for a new episode coming at you fresh next week. And as always, if you want to learn more about me and the work that I do, visit my website, noramahammed.com. Or if you have a listener question, email me at info@noraspeaks.com. You can also follow the Nora Speaks podcast on Facebook, Instagram, and Twitter at Nora Speaks Podcast. I'll be sure to include links in the show notes. If this show has value to you, please subscribe, rate, and review, and share it with family and friends. And be sure to check out previous episodes. And remember, don't just join the movement, be the movement. Stay in peace.